Welcome to POC Nurse. In this video, we're going to answer a CCRN question. Here is the question. A 55-year-old patient presents with a respiratory rate of 32 breaths per minute, patient is tachypnic, and a PaCO2 of 60 millimeters of mercury. What type of acid-base disturbance is most likely? Here are the options. A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. And D. Metabolic alkalosis. Let's get the answer. Now, the answer is A. Respiratory acidosis. Let's find out how we came to this answer. Let's find out what the rationale is. Okay, so for me, when I think about acidosis or alkalosis in respiratory or metabolic terms, I first go this way. If it's a problem with, if it's a straight question like this, like the CO2 is high or the bicarb is high, I usually attack the question like this. Anything to do with CO2 is respiratory. Anything to do with bicarb is metabolic. So in this case, we have a CO2 value. So our answer should be something respiratory. So either respiratory acidosis or respiratory alkalosis. Now, CO2 is high. When CO2 is high, acidosis occurs. So the answer should be respiratory acidosis. But let's see what the answer says. The rationale for this answer is that respiratory acidosis is characterized by an elevated PaCO2 due to hypoventilation or impaired gas exchange. A PaCO2 of 60 millimeters of mercury indicates CO2 retention. So here we see this patient is retaining CO2 because the normal levels for CO2 is 35 to 45 millimeters of mercury. So here we have retention, usually due to hypoventilation, but the question shows us that the patient is hyperventilating or tachypnic. And this is a compensation mechanism for patients that are retaining CO2. They kind of breathe fast to try to blow it off. Now, why are the other answers wrong? Respiratory alkalosis is characterized by low PaCO2, not a high one. Metabolic acidosis, here we have a low level of bicarbonate. In metabolic alkalosis, we have a compensatory increase in PaCO2. But then we should have a high level of bicarb, in this case, in metabolic alkalosis, because something is causing the alkalosis. So that is an increase in bicarb. Thank you for watching, and I'll see you in the next video. Don't forget to like, share, and subscribe. Bye bye now.